Rural hospitals are community strongholds, serving as the key point of care for nearly 20% of Americans. Beyond providing healing and hope, rural hospitals nationwide are pillars of their local economies, creating essential jobs that support families and community vitality. Many rural communities struggle with health issues that extend beyond their hospital's walls. Issues such as transportation, housing, employment, food security, economic stability, and other social determinants have an impact on the physical and mental well-being of a community. Hospitals are taking the lead to address social determinants as a response to population and community health. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. On this podcast, we'll hear from leaders from the Winona Wellbeing Collaborative, WWC, in Winona, Minnesota, who have combined resources to establish a community hub or framework for community-based care coordination.
Good day. I'm John Supplett, Senior Director of Rural Health Services for the American Hospital Association. Today, we hear a story from Winona, Minnesota, where local leaders have responded to the findings from their community health assessment and organized a framework for community-based care coordination, or HUB, to address community silos and gaps in health equity and social determinants of health. Winona Health is an independent, community-owned, and vertically integrated healthcare system located in a beautiful rural area nestled among the bluffs of the Mississippi River. Winona Health delivers care to residents of southeastern Minnesota and Trempealeau and Buffalo counties in Wisconsin. The system is one of the area's largest employers, with nearly 1,100 staff members, including more than 90 physicians and associate providers across a 49-bed hospital, primary and specialty care clinics, urgent care, assisted living, and long-term care residencies. Joining me today are Rachelle Schultz, CEO of Winona Health, Jessica Remington, Associate Vice President, Winona Health, and Vanessa Southworth, Community Wellbeing Director, Live Well Winona, which is the home of the Winona Community HUB. Well, thank you very much for sharing your story with us.
You're welcome.
Rachelle, let's start with you. Back in 2016, the findings from a community health needs assessment identified gaps in health equity, social determinants of health, and concerning trends with obesity, mental health, and alcohol and substance abuse. Equally concerning trends included societal stigmas, poverty, affordable housing, navigating support services, and that hopeless feeling of being stuck in an endless cycle. Now, that's a tall order for any community. How did Winona respond to these findings?
That is a tall order, John, for any community. And what we know is that data is really important for understanding these issues and these problems. And our CHNA has facilitated highlighting the depth and the breadth of these issues that are really hidden in plain sight in our community. So, for example, results from our 2016 CHNA revealed that those who completed the survey, 56% of our immigrant and refugee population worried about running out of food. Another significant discovery found that 28% of our Winona County children were eligible for free lunch, but only a fraction received that free or reduced price lunches, which indicated to us that there's a service gap to some of these vulnerable students. Other studies that we looked at showed that over 35% of Winona kids reported that they had to skip meals because of insufficient family money. And 11% of Winona residents were food insecure. And then almost 20% of people in Winona live below the federal poverty line. All of these really significant issues that might not be ours specifically to address, but they certainly impact health, as we know, as social determinants. So we use this information and this data to engage our community partners to establish the Winona Wellbeing Collaborative so that we would collectively take on these challenges as a community.
Well, can you tell us a little more about the collaborative, that is its members and its goals?
Yeah, so the Winona Wellbeing Collaborative is a group of partner organizations, all of which we have worked with in some shape or form individually. And this was to pull everybody together, collectively. So the organizations that are participating include the Family and Children's Center, which is a suite of services, the Hiawatha Valley Mental Health Center, Project Find, which works with our immigrant and refugee populations, our Winona Area Public Schools, our Winona County Services, our Winona Volunteer Services, which is our food shelf and some other support services, and of course ourselves, Winona Health. And then together, we work to impact these social determinants by removing barriers for residents that experience these health equities. And after a year or so of working together and sort of research and analysis about how we could approach this as a collective, our collaborative focused on efforts to address the fragmentation and the silos that exist between our agencies and providers, and addressing that through the implementation of a community hub model.
Jessica, what can you tell us about this community hub model that Rachelle's referring to?
Yeah, as Rachelle mentioned, the collaborative studied its current state and did a national landscape scan on hub-like models that reduce fragmentation among agencies. The selection and development was done with power sharing in mind, giving equal voice and equal voting to each participating agency, regardless of their organization size. The Pathways Community Hub emerged as the most advanced, evidence-based framework for community-based care coordination and the model for the Winona Community Hub.
So, Jessica, tell us, what is Pathways then, and how does it work?
The Pathways model has a 3-step process for mitigating risk in clients. It's find, treat, and measure. The first is find at-risk individuals within the community. The second is treat each identified risk with individual care procedures. For example, education, housing, food, social services, referrals. There's 21 different areas. Third, measure the outcome result for each issue. Community connectors, which are often referred to as community health workers, perform a vital function in the hub. They connect with at-risk clients, collect information to determine risk, and coordinate care using the Pathways procedures to help reach a positive outcome.
So then tell us, how does this actually work in practice?
All hub referral partners use a standard set of criteria to determine a participant's eligibility in the hub. To enroll in the hub, participants must reside in Winona County and then either screen positive for food insecurity, or have mental health concerns, or be experiencing homelessness. Within Winona Health, we continue to expand our social determinant of health screening processes to help identify those in need of support. At this time, more than 40% of our patients in primary care are screened for social determinants of health. We have a great system to identify risk areas, inquire on resource support needs, connect with social work, and refer to the hub if appropriate. Referrals are then made through the shared web-based portal, and hub staff at Well Winona confirm referral criteria and assign the client to a care coordination agency that best reflects their needs.
Tell me a little bit about what we know as community health workers and how it is that you recruit them and engage them as part of this process.
With community health workers in particular, they're based out of community care agencies, which is what Rachelle was referring to in the beginning. Agencies across our region that are working to improve the health, oftentimes nonprofits like Project Find, who work with the immigrant and refugee population. In our case, we have care coordination agencies that include Family Children's Services, Hiawatha Valley Mental Health, that's working with our WRAP Plus grant, so individuals that have been recently incarcerated, Winona Health, and Volunteer Services, which is our food shelf.
Great, thanks very much. So Vanessa, you represent Live Well Winona. Can you tell us how the referral process works between yourselves and the hub?
Sure. Once a client is accepted, a community connector arranges to meet with them and conducts a comprehensive screening process to identify risk areas. Then, based upon the results of the screen, the connector initiates different pathways for each identified risk factor. There are 21 different pathways, including food security, housing, mental health, healthcare coverage, medical referral, transportation, and many others. The community connector then works on closing each pathway by linking the participant to needed resources and services. The hub doesn't employ any community connectors or serve as a care coordination agency, but instead enters into agreements with other community care agencies that employ community connectors.
So then what are your functions with Live Well? What is it that you do?
The hub performs multiple administrative functions, including monitoring community connector caseloads and performance, as well as training and supporting community care agencies and referral partners. Live Well Winona also plays a very important role in developing a sustainable funding model for the hub. The goal is to sustain the hub through outcome based units billed for closed pathways.
Well, that sounds like the tricky part then, the sustainable funding by closing pathways. How does that work?
One of the national standards to achieve HUB certification includes securing a minimum of 2 multi-year health plan contracts. We are working with one of the largest regional Medicaid health plans to become the HUB's first contracted payer, and we're in conversation with other payers as well. Health plan investment depends on the HUB's ability to demonstrate a positive return, which in this case is measured by closed pathways.
Very good. Well, thank you, Jessica and Vanessa, for explaining to us the background as to how this process worked. Rochelle, what has been the result? Has it worked?
Yeah, so we've been very excited about these efforts and actually seeing how it works. I mean, it started as really an experiment. But since its start, we've had 325 participants that have been referred to our hub. And as of this month, there are 61 active participants with 156 open pathways. So keep in mind that an individual could have multiple pathways that are being worked on, or a family, that type of thing. And since our success is measured in closed pathways, we methodically, continue to work towards engaging, teaching, and closing these pathways for our clients. And these pathways sometimes can take a couple of months, to actually reach that closure, point. So I think we have to keep in mind that this type of work is a little bit different than what we do in sort of our normal healthcare settings. But our payers are also very pleased, and so is the collaborative. I think we've gained experience now through these 325 participants and seen good results for individuals and families.
How has this been an advantage overall to Winona Health? I mean, you undertake what is really a huge endeavor and you apply these resources yourselves and across the community. What has been the return to Winona Health as a result of your efforts?
So the way I've often described getting involved in this work is that as a hospital organization, we experience what is fragmented in our community on the doorstep of our emergency department typically, or, people coming in with some frequency into the hospital setting. And we've been very involved in, more of that population health, value-based purchasing, agreements and so forth. And so we really have to think differently about this work. So as we think about it, we have to put a stake in the ground, and that's what we did, with this work, to say, we can't be everything to everybody. We need all of these partners for us to be successful, and for all of us to be successful, and having, thriving individuals and a thriving community. And I think, as we've been able to do this work, we close those gaps between our agencies. We have better handoffs. People don't get lost in the system, fall through the cracks, all of those things that have been the history until we started doing things a little bit differently. So I think from our perspective, we have people who really are thriving and families who are thriving far better than they were before we had this approach.
That's very inspiring, and it's great to hear the story and how it works and what you can do with it. So, what then are the next steps for Winona Health?
So as we were talking about putting this hub in place, what we also want to be is certified. That helps us get that billing piece and that payment piece coming in also. So we've been kind of doing this work, all of our agencies, and including Winona Health, without that sort of undergirding of that payment flow. So our community hub was accepted into the Pathways Community Hub certification program. And we've completed submission of all of the required prerequisites for that certification. And now our next step is submission of proof of compliance with all of the Pathway national standards by the end of this month. And then we should have our certification, and then we should be able to start with our billing.
That is really exciting, and
It is
it's
exciting.
it's a tremendous accomplishment for you and your team, Jessica, Vanessa, and the others that are working on this project. It's thrilling to hear how you've taken the initiative to do something as progressive as this and to apply it to your community and then to see the outcome from that. So I know that you're going to achieve your goals of certification and then start that billing process. For their efforts, Winona Health was recognized as a finalist for the 2021 AHA Rural Hospital Leadership Team Award. Congratulations to you, Rochelle. The strength of rural healthcare is critical to the fabric of American healthcare, and it is our mission to safeguard it, improve it, expand it, and advance it for future generations. Thank you to our country's healthcare providers for their hard work, dedication, and sacrifice in this trying time. And thank you to the hospital and health system leaders like Rachelle Schultz, CEO of Winona Health, Jessica Remington, Associate Vice President, Winona Health, and Vanessa Southworth, Community Wellbeing Director, Live Well Winona, and the community connectors, nurses, physicians, social workers, counselors, and all the healthcare heroes caring for the community in Winona, Minnesota, and across rural America. This is one of several stories of how rural hospitals are rising to the challenge to transform healthcare and introduce innovations to improve the healthcare of their community. Visit www.aha.org to access these and other resources available to hospitals and health systems. This has been an Advancing Health podcast. Thank you for joining us.